organization, and we don't work directly with disabled people, but we support other DDPOs like Mert and Sil with work that they do. And I am a lawyer by the background, although I don't do practice law at the moment. I'm leading campaigning work, but part of the campaigning work is obviously making sure that disabled people know their rights. So today I was asked to talk about the CARE Act and what should happen under the CARE Act, what rights people have and what duties local authority has. So I will do that. I have quite a long presentation which covers many areas, and as Charlotte said, if you have particular question about something I'm talking about, maybe it's best if you just raise your hand and we can address that. I'm happy to be interrupted. So I will share my screen. If I find, oh, where's my presentation now? Yeah, here. Okay, so with the CARE Act process, there are stages set in law that local authority has to follow, which are assess needs. That's when they do needs assessments, decide if they have a duty to meet those needs. So sometimes they will do an assessment and decide that no, needs are not kind of serious enough for them to do something, and they will just give information and refer a person to some organizations where they could get help. Then if they decide that they do have duty to meet needs, they will develop care and support plan. They would also do financial assessment, because social care is not free, to decide how much you've got to pay. They will then provide support, or they will give you money to buy, purchase your own support or to commission it. And then they have to do a review. So they will check how good support is working, whether you need more or less, and obviously that would either start process again, so they would move to assessment and go down to deciding needs which they need to meet, and then do another plan, or they will just do a review and do some minor changes to the plan. So first stage is assessment. This is probably, from kind of my perspective, is the most important part, because if you get the assessment right, it will be much harder for them to cut support or to argue that you could do with a cheaper support option. So with assessment, the law sets out things that they have to identify. So effectively, it's the process where information is collected about three things. First is what your needs are. So what kind of needs you've got for care and support. Second is what outcomes you want to achieve and how meeting those needs will help to achieve those outcomes. So effectively, what do you want to happen in your life, and how you having needs met will help you do that. And then third, what's the impact of those needs on your well-being? And I'm not going to talk a lot about well-being today. I actually had quite a few slides before, which I deleted, but effectively, well-being is a very broad concept. It includes physical, emotional, psychological well-being, your ability to take part in community, your ability to kind of form relationships, your kind of physical health, as I said, your emotional health, mental health, your feeling as if you are in control of your life, you're feeling that kind of respect for your dignity, and so on. So effectively, they have to identify how much the fact that you have needs which are not met has a negative impact on all those kind of areas of your life. So obviously you probably all have been through the needs assessment, and first of all, it should be very easy to get it, because the threshold in law is really low. The problem is local authorities are now trying to reduce the number of people who get assessments, and they do all kinds of things. For example, say like, oh yeah, well, we're not going to support you anyway, so we're not going to bother assessing your needs, or you call them, either it's like 1 point or whatever numbers in the that they have on the website, and then you give them information, you never hear back from them because for some reason they decide that you don't really have needs serious enough to trigger the assessment. Shouldn't be like that. They should really assess everyone. Assessment is not kind of set in stone. It could be the Care Act talks about proportionate assessment. So sometimes if person needs are quite straightforward and they know what they want.
Can you click on that, please?
Yeah.
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 Okay, and you're in.
Okay. Yeah.
Sorry.
And when I finish with it,
Alma,
I go to the.
I'll put her on mute. There you go.
Oh, okay. So I thought someone said, "Can I say something on it?" Oh, okay. But effectively, if you ask for an assessment, the answer should really be yes. We'll do it. Same applies to reassessment. So when you contact them saying my needs have changed a lot and I need you to look at this again, they should act upon this. Unfortunately, because of kind of resources and the fact that they don't have enough social workers or assessors, they usually ignore this until there's crisis or until you complain or someone instructs a lawyer to act on their behalf. Then they act very quickly. So assessments should normally be face-to-face, but now of course they are remote, and there is also an option to do a supported self-assessment, which is effectively they send you like a form to fill, and you do that, and then social worker kind of looks at it and decides what needs you've got, and what outcomes you want to achieve and what impact on your well-being. Supported self-assessment is an interesting thing because for some people who really know what their needs are and what support they might need, it might be a better option because you have a chance to record everything. Whereas if they do assessment for you, just reality of how it is done, they have a short meeting with you where you often don't have time to discuss everything, and then they record something, and then they have usually they have some kind of probably computer generated template that then fills in more general information. So sometimes I could see assessments with outcomes where people say I didn't even talk about this, but they are there. So if you feel like you know what your needs are, you know what you want to kind of achieve in your life, what your goals are, what you want to happen in your life, you can describe the impact of those needs on kind of your physical, emotional, mental well-being, then maybe self-assessment option is the way to go. At least, as I said, you will have everything recorded. But it's not, of course, an option for everyone. So according to Care Act guidance, local authority must provide information about the process, and they must, for example, send questions in advance. I say this in those kind of training sessions. The problem is I've never seen I've seen very few cases, no, never is not the right word, where they actually did that. But it means that you can ask them to send questions in advance and to tell you what are they going to talk about during the assessment meeting. And of course, what happens a lot is that assessments are motivated by desire to cut packages, but by law it should never be like that. So they should come to you with an open mind, and well, this is how at least it was envisaged in law, and this is how law requires them to do that. They should come with an open mind, talk to you what your needs are, record everything, and then make decisions after that. So the process, they should speak to you during the assessment. It's important that assessor has the right skills. So the Care Act guidance talks about some specific impairments like sensory impairments, learning difficulties, mental health support needs, autism, that assessors have specific, skills or qualifications to assess the needs of those people. But you can always ask what kind of experience person has in dealing with people who have with your impairment or have similar needs to you. And it's worth asking, because obviously more experience and skills person has, the better assessment will be, because they will just understand what you're talking about. So they have to speak to you. If needed, they have to make sure that you can be involved. So what often happens especially with people with kind of learning difficulties, some people with autism, they wouldn't necessarily speak to them. That it's easier to speak to carers, and it's easier to they need to take extra steps or take extra time to engage with person. They just go for easy option. That shouldn't happen. They should speak to person. They should and can speak to carers, but or people that support you if you are happy with this. I came across situation, one local authority in London, they demand speaking to PAs, personal assistants, for example. That shouldn't happen during the assessment, or not, at least if person doesn't want them to. So they also should allow whoever you want to be present at the meeting. Again, I've seen problems with that. It depends on how difficult the kind of relationship is. In situations where they do come to effectively with a purpose to cut person's package, and people bring the others who could kind of help them and stand up for their rights and so on, there might be some kind of hesitancy to let those people be in those meetings. That again shouldn't happen. And of course you should be given a copy of the assessment, and it's important, really important, to try and push them to get that. I know so many cases where people did not have a copy of their assessment, did not have a copy of their care plan. It's all just emails from social workers effectively telling them how many hours they would get. This and it's really bad, because if later on you want to challenge something, you need copy of those documents. So it's important maybe to talk about advocacy right now. So when they have initial conversation and they see that person would have difficulties to engage with the process, and there's no one else to help that person, or no one else who's appropriate to help that person, then they should appoint a Care Act advocate. Again, reality is that local authorities, because they have to pay for them, they're really reluctant to do that. They would try and kind of see if there's a relative or someone else who could help. Yeah, if you feel like it's difficult for you to engage with and take part in the process, and there's no one else to support you do that, then you should ask for an advocate before assessment takes place. For you as disabled people, what's important? It is important to talk about all your needs, even those that are met by carers, because in assessment they have to record all the needs. You have to think and explain, if you want good outcome, explain how those needs have an impact on your well-being, you have to make sure you kind of talk about the worst risks. So I know this is really depressing. It's similar to benefits assessments where you kind of have to go and think about the worst day and kind of describe it. But really, the problem is, and what local authorities are trying to push people now is they use this process of strength-based assessment where you kind of talk about good things about your strengths, and then you kind of pushed to talk about good days and what you can do. So then it could be used to potentially cut care packages. So it is important to think kind of realistically. Yes, if a bad day happens, once a year, maybe it's not appropriate. But if a bad day happens often, then it may be a good strategy to focus on a bad day and to effectively kind of not necessarily exaggerate your needs, but remind them that it's not all kind of all just very going really well, and there are risks. So what I'm talking about, I'll just illustrate by example. So for example, now there is a push to reduce human support and move people to use different kind of aids and also just generally a push to reduce human support. And one assessment that I've seen, there was a person who she had to transfer, and she had problems with transferring from wheelchair to chair or to other places, and she fell. Yes, she didn't fall every day, but it happened like maybe a few times a month. And her assessment effectively said that yes, it's a risk that she would fall, and she had to go to hospital after some of those falls. And an assessment said yes, there is a risk that this person will fall, but we all take risks every day, just as human beings. So it's acceptable to kind of for the person to take that risk and just use equipment instead of human support.
Svetlana, we're just going to take a moment, just sorry to interrupt you, we're just going to take a moment to switch interpreters.
Yep.
Great. Thank you.
Cool. So so that's why I suppose I'm talking about a bad day. It's important to think that some of the when we talk about positives and we kind of are pushed to talk about our strengths and what we can do for ourselves, we might just forget about the fact that we do need support. It's probably, well, it's best if you can get questions to think about answers in advance, so then and probably make a note if possible and just go for it. That's why I was talking about supported self-assessments for some people. Obviously, you need to make sure your communication needs are met, and local authority has a duty to do that under the Equality Act. So it's a different law, but you can just tell them that they have a duty to do that, like book interpreters, give you information in accessible format. If you need more time, for example, to think about answers, they should give you more time. The problem is, in reality, people don't ask for it. And what happens, as I said, is social workers or assessors say, oh, no, sorry, I don't have time. We have to finish here. And I don't really have time to come back. And then you wait for a couple of months and you get assessments that you can't even recognize yourself from. And obviously, as I said, get a copy of your assessment. You can ask. So just ask, where is a copy of my assessment? You have to give it to me under the Care Act. And if they don't do it, there's another process where you can ask for a copy of it under data protection law. So if there are problems, I'm happy to kind of then later describe how that could happen. So what to do if you don't agree with your assessment, what's written in there? And well, I'm sure people here on this call would kind of relate to this, or if not, then it kind of shows that your local authority is good. But I've seen so many people who do not recognize themselves from the assessments, and there are like big mistakes, and lots of information omitted, and as I say, sometimes it feels like it's like an electronic template generator that just they use to fill in bits that they didn't discuss with you, or the bits that maybe they didn't take a good record of. So but it's also sometimes, because ultimately social worker decides what your needs are, although the Care Act says that they have to keep in mind that you are an expert in your needs, and they have to take your wishes into account. When it really comes to kind of challenging and confrontation, by law, social worker has a right, is the person who decides what your needs are. And so if they, for example, say you have a need, I don't know, so real case, obviously the one that went to court, they can say you have a need to become more independent, and to meet this need, we will cut your support. They basically are empowered by law to do that. So if there is such a situation, then what you can do is ask for explanations. You can ask them how basically how that would promote your well-being, because they have a duty to promote your well-being all the time. So you can ask them to add missing information, because sometimes it could be vital to to then later challenge the assessment altogether. So for example, they could totally not include the fact that you were you had a major, I don't know, fall or some kind of accident because you didn't have support, and you were, for example, admitted to hospital or something like that. They could totally just not include this, because that might mean that they would have to increase your support package. So it's also worth, if you really kind of disagree with assessment, check what knowledge assessor has had, and potentially if they didn't have the right knowledge, especially for specific conditions which I mentioned earlier, you could ask for a different person to do an assessment. Also, it's always helpful to present evidence from other professionals. So for example, if your GP says one thing and the assessment says another, then of course you can send them this information and ask them to explain why they disagree. If you were not involved, or if your needs were not met properly, again, you can challenge this as a process. Just say that they have to do it all over again. But ultimately, I think for us to be realistic, it's important, as I said, to remember that by law, social worker decides what your needs are. Although they should take your view into account, they will make a final decision. But if they disagree with you, they have to explain why and have to come up with reasonable explanation. Okay, so are there any questions about assessments?
Yes.
Okay.
I mean, not really, but it's really interesting what you're saying, because I haven't had an assessment for 3 years, so it's really quite bad, and I need lots of help. So my dad doesn't want to do it till after the pandemic, but we are writing things, because I'm a very busy person. We're writing things down so that when things do get back to normal, I can have another assessment.
yeah, I think that is a very good strategy, actually, to write things down, like when they happen. Sometimes I know for benefits assessment, people often advise to keep a diary, or when you need
Yeah.
kind of help and so on. Actually, it might be quite helpful for social care, so the care needs assessment as well. But I think I don't know. I think the fact that you didn't have assessment for some time, it may be a good and a bad thing, because assessments don't necessarily lead to increased support. They might lead to cuts in care packages. So I think the key question to ask is whether you're happy with support you've got, and if not, then if you think you need more, then it's worth kind of asking for
Yeah.
another assessment.
Because I have an agency, so I'm paying a bit more than I should. So that's why we're looking at my assessment and asking for another review.
Yeah, I think first thing, basically, you decide if you need more support, then potentially if you can get so if an agency supports you, I suppose agency might not necessarily agree to do this, but they might, if they feel like, yes, you probably, they could kind of support this view, then that would be another good evidence for
Yeah.
social workers to take into account. And
Yeah.
but I think, yeah, first of all, you need to decide whether you need more, and then probably kind of look realistically, and it's good like groups like this one exists, potentially how likely you are to get more, because obviously if you think you need more, it doesn't mean that you will get more. So
Yeah.
and potentially other people could help you see whether, or advocacy services, because
Yeah.
many cases they could probably kind of have a view on how likely you are
Yeah.
get more based on your situation. And then obviously
Someone from Still is helping me, but we've agreed that after the pandemic, when we can all sit around the table together.
I think that definitely sounds like a good, hopefully, like a good situation. And then say if you record things, then you have kind of a lot of evidence.
Yeah.
We had a question from Fiona in the comment section. She asked if you could record assessments.
So that is interesting, because there isn't like with benefits assessments, for example, there is like specific specific bits in regulations which say yes, you can, but these are conditions that you have to meet to do that. Here there isn't anything in the guidance to say that you could or you couldn't. So but obviously you kind of have to comply with data protection laws. So you do have to inform them that you want to record it. I actually do not see any reason why they could tell you you can't do that. So and you can also say, for example, and I don't know, I suppose it depends on people's kind of needs and impairments and access requirements, but sometimes you can make a good case to say, I'm really, because of my impairment, I will struggle to make notes. I want to keep a note of this and what has been said and what I said. And the best way for me to do that, to meet my, because of my impairment, is to record it. And if they say, for example, they are not happy with you recording it just in principle, you can say, well, can I then record it as a reasonable adjustment? Because obviously it's only logical that you are able to keep a note of what happened in that meeting, because the meeting is important. So I hope I answered. So basically, first ask if it's possible. If they say no, you can ask why not, and see. It's probably best to do it in advance, but you can take a chance and just do it in the meeting. Recording secretly, I would advise against that, because but I suppose yeah, I suppose it's better to first ask, and then ask if you could do it as reasonable adjustment. Recording secretly is problematic, because obviously if people, for example, don't want, because people have their kind of rights, data protection rights as well. And secondly, if you kind of will start challenging, if you go to court or you go to ombudsman, they might not agree to take your kind of secret recording into account. Although sometimes when it's if it's absolutely like situation is awful, I know for example, in other very different context of kind of employment discrimination cases where people left microphones to record meetings of managers about them, for example, tribunals did take this into account, although saying like this is really bad, it shouldn't have happened. It kind of shows that the person who did the secret recording is also not such a of a good character, but they did take it into account if it's obviously revealing. So in that case that I'm referring to, they were effectively talking about how to sack a person, how to really discriminate against them. So yeah, it's a difficult, I suppose it's a difficult situation. I would say ask first, ask to do it as reasonable adjustment, and if everything fails, then it's probably better to challenge their refusal to let you do that rather than do it secretly.
Thank you.
Okay.
Sorry, it's time for a break now. If no one has any questions, is it okay to take a short break?
Yeah, I think it's very logical. Let's do that.
Yeah.
Good time to do that.
Is 10 minutes okay for everybody? Is there anyone that would need longer than 10 minutes? No? Is 10 minutes okay for the interpreters and the captioner? Yep. Perfect. Okay. What's the time now? 45. So are we all okay to come back at 1:55? So 10 minutes, get a cuppa or whatever you want to do, and then come back. Perfect. Perfect. See you all in 10 minutes.
Next. Oh, why is it not working? Oh, no. So, basically, once the assessment is done, local authority needs to decide what needs they have duty to meet. There is what's called eligibility framework set out in the Care Act. And I'm not going to kind of really go into this. I think if after good assessment, they come with a decision that they don't have a duty to meet certain needs, and needs are not eligible, then I would say it's probably best to, especially in Merton, to kind of talk to Merton Sill and get advice from people who understand the Care Act to see how best to challenge this. It could be that you could present a different view on how needs impact on your well-being, or you could maybe, because eligibility framework is basically based on looking at needs having impact on important areas of life which are set out in law, so they could look at that, or the impact or on well-being, and so yeah, I suppose best idea is to get advice. What's important to know is that about kind of the link with assessments and the needs and eligibility decision. Local authority has to identify all needs in assessment, but they only, as I said, have duty to meet needs which are eligible. So not all needs necessarily will be met, but we think it's important to write down all the needs because you never know. And now after assessment, they will tell you whether they have duty to meet needs or not. And they have to tell this, send it to you in writing. So it's worth getting this decision and getting an explanation, especially if they come back saying, oh, some needs are not eligible, we're not going to meet them. So it's worth asking for an explanation in writing why they decided this. So again, another thing that's really important to know is when they do assessment and when they make decisions about needs that they have duty to meet, they should discount all the help that you get from carers. So it doesn't matter whether you have help from someone, carers or other, like organizations or whatever, to meet those needs. Those needs will be your needs and they will be eligible needs. So local authority will have duty to meet them. But when they decide how to do that, they could say, well, they will be met by carers, so we don't have to do anything. So you will effectively, under the Care Act, have needs for support. They will be eligible for local authority to meet, so local authority will have duty to meet them, but they will be met by carers. So this decision could be made only if carers are able and willing to do that. Also, it's important, even this is the case, to get this decision, because if carers' situation changes and carers are not able to meet those needs, local authority will have duty to do that, and they would either have to give you direct payment or would have to arrange support for you in a different way. So wanted to say a few words about financial assessments. Obviously, very quickly, social care is not free. It's means tested, and law allows local authorities to charge, but it is local authorities' decision to do that. So it is a political decision to first of all, charge people for support at home, and second, how much they would charge. Although national the Care Act sets out some minimum guarantees, so minimum requirements, apologies, that they have to follow to be able to charge you for social care. So if local authority decides to charge, they should publish a policy. And so Merton, for example, has a policy which is, I think it's on the website. So it is important to have a look at it to kind of understand how the process will go and what you will effectively be left with. And there are services for which they cannot charge for, and these are reablement and rehabilitation services, so time limited, usually 8 weeks after hospital type of services. They can't charge for equipment, and they can't charge for aftercare services, which are for people who were detained under the Mental Health Act, and they get discharged, and then support is put in place for them in the community, and basically those services are aimed at preventing readmission to hospital for these people. So it's very kind of specialist area, but it's important if someone is being discharged from hospital from being detained under the Mental Health Act. It's important to look at their care package and what could be included as aftercare services, because obviously that will be free and there is no time limit to it, so it could be like forever effectively, and that would be a way for a person to escape charging for social care. So as I said, the law sets out some minimums that you should be left with. They call it minimum income guarantee. It depends on age, family situation. It depends on premiums that you get, like disability premiums that you get in your benefits. but yeah, effectively it's from I think 94. I now could be making mistake, from around £94 per week to 100 and like around £200 a week for older people. So local authority will identify this based on information about benefits that you've got. So people who are working, they will disregard income from employment. So they take into account two things. I really should follow my slide. Capital, so how much savings you've got, and income. And so capital, there are upper limits, 23,000 to 50, I think, after which you'll have to pay for care in full. So if you have more money than that, you have to pay for your care. And there will be a question whether it's worth local authority even getting involved in all this. Then if you have less than that, they will take capital into account, and they will apply, as with means tested benefits, what's called tariff income. So for every 250, they will treat as like £1 of worth of income that you've got. They will disregard, as I said, earnings from employment. So effectively, charging is, I mean, okay, I'm going to go a bit off my script, but charging is a very unfair system because, well, it obviously makes people who have savings pay a lot for their care, but on the other side, it targets people who are already on means tested benefits and makes them pay. And effectively what happens is that daily living components of DLA, disability living allowance, and personal independence payments or attendance allowance is taken away from people to pay for their social care. So so what's important, they should disregard your mobility component. They should disregard your costs associated with housing, like mortgage, service charges, rent, and so on. They basically, yeah, I think I mentioned all that, and they should, if they take into account your DLA or deduct your disability related expenditure. So disability related expenditure is effectively the best way to reduce charging if you can show it, because most of the time local authorities give some kind of money that they disregard straight away, and if you go above that, and I think, does Merton have £10 or something? I'm not 100% sure. I think Merton has some disregards a bit of money, but then after that, if you want to claim more, you have to prove with receipts your expenditure. So what it could be, and sometimes it's very difficult to think about it because, you know, just live and spend money. You don't think whether you spend it because you're disabled or you just spend money. And so this, I try to set out some ways to think about it. So anything you have to pay or buy because you're disabled, because of your impairment. So it could be higher energy bills, and you could ask. It's also difficult. You never know. Like, I don't know if I pay more for electricity or not. It's just because I don't know how much other people pay. But local authorities should give you this information, and you can ask what's the estimate for a kind of average household of your type for bills. So then you'll find out the difference. It's about buying and maintaining equipment. And with equipment, there is a problem again, because often what they would say is that this equipment, for example, that you bought might be available through the NHS. And often it's not true. Like, for example, for wheelchairs, they often, I've seen quite a few cases where they would start arguing that you could get this free wheelchair free from the NHS. Why did you spend, thousands of pounds on electric wheelchair buying it yourself? And then will be a case about describing how what you get from NHS is not right for you and not appropriate. And unfortunately, yeah, it might need an argument with social services. Another thing is, but also equipment, it doesn't have to be like specific equipment that is designed for disabled people. Sometimes it could be like general things, but that are more accessible. I don't know. I've seen people being able to justify, for example, buying an iPhone because it's more accessible than other phones for them, and things like that. So anything you have to buy more for, so clothing, washing powder, whatever. Extra support to maintain your home, garden, just extra support that you pay for. So that there is often with local authorities, there's a problem because they say, well, if you buy extra support, our social worker needs to kind of approve it and say that it's, yeah, you do need it. There isn't anywhere in the Care Act to say that this is the case. And actually social workers do not have to approve your disability related expenditure. Yes, if they think that things that you buy or you get are available somewhere else for free, for example, and you're not getting that, that's another story. But to say that our social worker doesn't think that you need to pay for this or that support is wrong, and it's definitely should be challenged. So yeah, more expensive products, and basically, yeah, as I said, local authority could take into account if that could be purchased somewhere cheaper, but you just need to make a good case why that cheaper is not good for you. So what if you don't agree with charging assessment? So first of all, you can ask for review. I don't know, different local authorities call this process differently, but it's either appeal or review, but they have to do it under the Care Act. You need think about disability-related expenditure, and this is really, as I say, the best way to reduce your charging, your contribution, because we just don't realize how much money we spend extra on our disability-related expenses. It's worth sometimes putting together a list of income and expenditure just to show them that you can't afford to pay what they ask to pay, and that local authority does have a power to let you not pay or to reduce your charge. So they make it look as though they are forced to charge people and they can't do anything about it. It's really not true. They have power to reduce charges, and they have power to waive them completely. They have power to decide not to charge people altogether, and so on. So it's worth kind of asking them to do it as like maybe a hardship thing. So then it's worth getting benefits advice, and I've seen this is really, I would say, kind of to me unbelievable, but local authorities often get benefits calculation and charging assessments wrong. So first of all, it's worth kind of making sure that is correct. And secondly, if you still feel like you really don't have enough money left, it's worth just checking whether you could get more income through benefits. But as I said, some benefits will be taken away to pay for social care. So it's it's important to keep this in mind. So for example, thinking whether it's worth going and applying for attendance allowance, if that attendance allowance will be taken to pay for social care charging, will that actually leave you with more money in your pocket? So local authority, ask them to explain why they think you can afford to pay your contribution, and just worth knowing that outcome of charging assessments could be challenged either legally through the solicitors or going to the ombudsman. Okay, I don't know if there are any questions.
Does anyone have any questions? You can turn your mic on or put them in the comment section and I can read them out for you if you have any. No, if any come through in the chats, in the comments, Svetlana, I'll read them out.
Yeah. Okay, cool.
Svetlana, sorry, can we pause for a second so we can start?
Yeah.
Yeah, sorry. Let's swap you over.
Yeah, is that all right? Yeah, I think so. Yeah. Duty to meet. I don't see. Oh no. Is okay, Alice? Yeah. Okay. So duty to meet needs. This is important. So once local authority recognized that they have duty to meet some of your needs or all of your needs, they then have to meet those needs, no matter what. There is, and that's why I mentioned, for example, it's important to get this decision, even if your carers meet the needs for now. If local authority has a duty, then if something happens and carers are not able to do that, local authority has to pick it up. Or, for example, if your care package breaks down and agency is not able, for example, to provide care, then local authority has to act and put alternatives in place. This, I think, has been a huge problem during the pandemic because local authorities effectively just stepped away and didn't do anything and left people without support. But in legal terms, so the fact that needs are not met could be challenged because that from the legal point of view, that duty is more or less kind of absolute duty. They have to make sure needs are met. It doesn't always happen in reality because it's difficult to challenge, though. It's also important that there is no fixed way of how needs are met. It doesn't necessarily have to be certain service, certain agency. Some people might, feel that even having like support might not meet their needs, but maybe going, exercise or doing other things might meet their needs better. So local authority at least in London in kind of recent years put all kinds of restrictions on this. So it's saying, for example, we will only fund support that is either by person or by organization, and we will not fund anything else. We're not going to fund you going to certain activities or doing certain things. It's not how the needs will be met. So that potentially is wrong and could be challenged if you can prove that whatever way you think is best will meet your needs and it will meet them better than how local authority suggests. Okay, so what local authority does once they've made a decision that they have a duty to meet your needs, they will develop support plan. Again, under the Care Act, what they envisage that would be a collaborative process between you and local authorities, a social worker, or kind of someone else from social services, where you decide how best to meet your needs together. And we'll try to kind of innovate, come up with different solutions to do that. It's just not, but in reality, this is not how things are. One thing that it is important for us, I suppose, to know is that local authority usually goes for the cheapest option. They kind of do not have to fund more expensive option just because you say so or you think it's better. If they feel that cheaper option meets your needs, they most of the time will be able to justify why they insist on it. However, the Care Act guidance talk about kind of better, not cheaper option, but better value for money, and considering a kind of positive impact of the more expensive option, which, you know, better value for money is very different from cheaper option. In reality, as I say, they just insist on the cheaper things. But I think this concept of kind of better value for money could be very powerful in the cases where they insist, for example, person goes into a care home because they think it's cheaper to support them there if they need very, very kind of extensive package of support. Here also, during the support planning process, you can decide that you want direct payment and you want to arrange your own support, or you can also decide that local authority should do that, or you can choose what support you arrange yourself and what they should do. Again, in practice, I've seen many cases where they say, no, you should choose either doing it all yourself, or we will do it everything for you. And that, again, that shouldn't be the case. It's not how the Care Act kind of saw this. Could be a combination. So what shouldn't happen? They shouldn't have blanket policies, like, for example, as I mentioned before, we're only funding support as like from the agency or from personal assistance, but we're not going to fund you going to different places to meet your needs. They can't have upper limits on how much help. So like they can't say, well, we only fund support that costs this much and nothing more. With in reality, again, the problem is that social workers put support plans, they then send them to the panel, and panel who doesn't even know like the person, they don't know anything about them, they try and cut them, often keeping in mind the budget and kind of upper limit. So it's not communicated as a policy, but often it could be just how things are. And so it's worth always kind of investigating and checking and challenging. They can't force you to accept direct payment. And again, I've seen quite a few cases where people get support arranged from local authorities, usually through the agency. Agency doesn't, that relationship doesn't work. And local authority says, well, you know, the only thing we can offer now is for you to take a direct payment and do it all yourself. Or they say, we only can support you by giving you direct payment. So that shouldn't be a situation. And if this is the case, then it should be challenged, really. And if nothing suitable is available locally, local authorities should take steps to commission this. But so this especially is important for people who are kind of stuck in residential facilities because there is no appropriate support option for them in the community. But it could be also, you know, other things. So in terms of challenging, I think the biggest problem with support planning is that they effectively come up with a cheaper option, which is not what you want, and they insist that this is appropriate. Sometimes they could even so when we talk about direct payments, they could just say, well, we think that your needs could be met with this amount of hours, break it down, have 30 minutes in the morning, 20 minutes in the afternoon, and I don't know, I'm making it up, but you probably would recognize what I'm saying, and like 1 hour in the evening, and then a couple of hours a week to do all your social interaction and shopping and so on. So this basically how to challenge this if you think it's not enough or it's not the right option. is effectively to look at three things. Will it actually meet your needs? And you can ask them for explanation of how will it meet my needs? If I, for example, need 30 minutes only to, I don't know, get dressed, and I still need to eat my breakfast and still need help with this and that in the morning. It will not help you to achieve agreed outcomes in the assessment, and it will not, the meeting needs in this way will have a negative impact on your well-being. So this is why I said at the beginning that assessment is really important. So you can always go back to it and say, these were my needs, these were my outcomes. What you're proposing is absolutely not gonna meet my needs and not gonna help me to achieve the outcomes. It's kind of really worth remembering, though, just to go back down to earth, that social workers still decide, unfortunately, despite all the provisions of the Care Act, that they have to take your views into account, and they need to really kind of appreciate that you are the expert. They need to promote your well-being. They decide how best to meet your needs, and they decide what will promote your well-being. So as long as they can explain their thinking rationally, they can sometimes get away with cuts. But I've seen quite a few cases where people were able to challenge this effectively by kind of referencing those three things. And I've been able to challenge quite a few cases for people, again, saying that the support that they're offering is not going to meet people's needs. And that's, if you get a very detailed explanation, description of needs in the assessment, then it will help you to challenge care and support plan. Okay. So initially, if you get usually what people get is they get assessment and eligibility decision and a plan all together, mashed in kind of one, sometimes even in one document. And it's important to kind of go through this in stages and relate needs in the care plan to the needs in the assessment, try to focus arguing on these things. You can also challenge, so for example, if advocates should have been involved and they were not, if your needs were, communication needs were not met, if you were not involved at all in devising your care and support plan, you can challenge it. So challenge the process with the hope that they will go back to page 1 and start all over again. So just a few words about personal budget. Personal budget is effectively how much your support will cost. You should be told what your budget could be at the beginning when you kind of start support planning, but it should be adjusted depending on how best your needs are met. And obviously amount should be enough to meet your needs. That's why when they come back with, for people, for example, on direct payments, they come back with a sum of money. You need to really break it down and ask them how exactly it is enough to meet your needs.
Excuse me.
Yeah.
Is that for like if your chair breaks or anything to do with your impairment, if your chair breaks or anything like that, isn't it?
So no, so personal budget is effectively money that you get to meet your needs. It could be money that you can get money to buy your, I don't know, respite care. You could get money to buy your everyday support. This money could be to pay for equipment, or to, but like
Yeah.
they would. So it's whatever they think you need to have your needs met. They will kind of calculate how much that will cost, and they will tell you. And so you can either take it as a direct payment, or it could stay with local authority to manage, or they could ask third party to manage it for you. Okay, so I want to say a couple of words about direct payments. Charlotte, are we going to have another break or not? Are we?
Yeah, I was just going to interrupt and say, do you want to have a 5-minute break and then finish? You can finish off your presentation and have a few questions.
Yeah, whatever.
Yeah, is that okay? Is everyone okay to take a 5-minute break?
Chantel? I don't know whether I'm on mute or not. Hello?
Hi.
Hi.
Chantel, it's Yolanta. I'm checking
Yolanta.
whether I pressed correctly, whether it's muted or not, unmuted. It's fine, so it looks like you can hear me.
Okay. Okay, so we're just going to take a 5-minute break. We'll come back at 2:35 and carry on, if that's okay.
Yeah.
Yeah. Perfect.
Or they think it's not the best way to meet your needs.
Excuse me, Lana, could you just say what a DP is? Is that direct payment?
Direct payment, yeah, sorry. Yeah, it is a direct payment. The amount of direct payment should be enough to cover all the associated costs. So if some of you are on direct payments, you know this better than me, that you have to have insurance, you have to pay for like you are effectively becoming an employer, and there will be costs to that. You have to pay different like taxes and contributions. You have to pay for the potentially holiday pay. If you make people redundant, you have to pay the redundancy. If you also have to pay for recruitment, for if you need to train people, you have to pay for training and so on. So effectively, direct payments should include all these costs. I know also with increases in minimum wage and just like general salary increases, local authorities have to top up that, because often, well, not often, but sometimes they don't. So basically check the amount and ask how that is enough if you think it's not enough. Then direct payment could be given as prepaid card, that basically some kind of like, well, it would look like a credit card, but it will be linked to online system, and you'd have to make payments using that, and they will collect all the information about your transactions. But local authorities often insist on people having that because, first of all, it's much easier for them to monitor what people do with the money, and second, which is more, I think, from our point of view, dangerous, is that they could automatically claw back money. So if amount on your account is, for example, bigger than different authorities have different policies, 3 months or maybe 6 weeks worth, they would just take that money automatically back because they are able to see it through prepaid card system. So those people who think that it's better for them to have direct payment on a just general bank account, separate bank account, but that they manage, should be allowed to have that. Local authorities are trying to put all kinds of barriers to not make this happen, but you can ask for it, and they should come up with very good reasons not to allow you to do that. The guidance says that you should be allowed to do that.
Sorry, in Merton, you have to use the card they've provided. You're not allowed to use your own bank account.
Oh, really? So has this been
Yeah.
challenged?
I think it has occasionally, but for some reason they just want to keep it separate, and you have to have a card which they give you.
So I think, yeah, I mean, basically, I know that
Fiona said in the chat that she's going to challenge it.
yeah, I think what happens, I would say that you can challenge that, and usually when people do, they allow them to have direct payment on the bank account as an exemption to their general rule, because they know that if you go kind of further and challenge it to the ombudsman, or you get lawyers to look at this, then they will lose, because the guidance is clear that they should allow maximum flexibility. And I think unless they have good reason to believe that you will misspend the money, or you need extra controls, they can't really force you to have a prepaid card. I think also there are kind of privacy concerns with, for example, for me personally, although I appreciate that some people might find it easier to use a prepaid card because you don't have to collect as much and keep as much monitoring information as people who have bank account. But just knowing that someone could log in all the time effectively to see what am I doing with the money, and kind of when I'm spending it, just, yeah, for example, for me, it makes me really uncomfortable. So it's worth challenging. And I think I could bet, I don't know what, £1.10, that they will allow you to have money on your account as an exemption. What also is important so local authorities now putting more and more restrictions on direct payments, and this is really kind of contradicts the CARE Act guidance and the CARE Act spirit, because the purpose of direct payment is to allow people to have flexibility and to allow people to innovate with how they are supported. All the restrictions that local authorities are imposing are reflected in direct payments agreements that they sign with you. So it's worth reading that agreement, and if there are things that you really disagree with, it's worth raising them. And I know it's a pain, really, because often they will say, well, we have a template, which they do. They have a template that they force everyone to sign, and effectively they would say, well, if you don't sign it, you're not going to get direct payment, and so people are kind of stuck. I would say, if someone really, for example, some agreements could say you can't employ your relatives full stop, when the CARE Act says you can't employ relatives, close relatives that live with you, and there's difference between those two statements, a huge difference actually. So they, for example, could say you can never withdraw, take money in cash and pay in cash, when the guidance says that, yeah, why not? People should be allowed, as long as there is evidence where what the money was paid for. So things like that. If you feel like it's really important for you to be able to do that, then it's worth kind of checking with the guidance or checking.
Sorry.
So yeah, go ahead.
Someone's put in the comments that. So it was Fiona. She said, I'm going to challenge this. I get education paid through a bank account. They make charges per transaction using card, and this isn't covered in direct payments.
Yeah, exactly. And that is really good point to challenge them on, and either pay more for direct payment or give me opportunity to, yeah, exactly. Well, I'd love to hear how this goes. I hope, I'm sure, as I say, I'm sure they will let you keep money once you start making their life difficult with that. Yes, another thing that people often ask about direct payments is what you're allowed to spend them on. So effectively, you are allowed to spend direct payment on anything that would meet needs how it was described in the care plan. So now there are more and more people who unfortunately are stuck with very prescriptive care plans which describe to the hour how they should arrange their support, which makes it really, really difficult. And so like if your care plan says that you should have a certain amount in the morning, in the afternoon, then in the evening, it's really difficult to then, for example, save up and use it flexibly, have more hours on the weekend or something like that. So it's important to keep this in mind when they draw your care plan. Maybe have just kind of allocation per week, which you would be able to spend flexibly. Another thing is clawing back money that so often what happens is people don't spend their direct payment for various reasons, and sometimes very good reasons, like not being able to recruit because the salary is too low, or being in hospital or PAs getting sick and not being able to support you. And local authority, what they do, they first of all make you pay contributions still, so you pay your charges, but then they claw back the money, they take money back. And it's important to try and preempt those situations and just keep an eye on the direct payment. And if there is money left, then I would suggest going back to social workers and kind of being proactive and saying, yes, I didn't spend this money on this, but I need this money to do, something else which would meet my needs in the care plan. So I'm not sure why it's not moving. So just very quickly about review. So local authority actually is obliged to review care plans. They don't do that, but the purpose of review is just to make sure everything is working well. If they want to make substantial kind of cuts and changes to support package, they have to go through what's called revision. And revision is effectively, they have to assess your needs, they have to go through the whole process again. So if your support was cut after review, first thing that I would do is I would ask for the reassessment and a copy of a new support plan, and why. Ask how did it happen that you were not involved in those two key stages as set out in the Care Act.
Okay. Hello, can I ask about something? Can
Yeah.
you hear me? Hello?
Yes.
Yeah. I wonder, I'm really desperate to get a social worker. I'm having for many years a problem with the noise. I cannot sleep in the night, and I'm struggling with clarion housing. I'm in a very tense situation at the moment. I don't want to go private talking a lot, but I live in the UK on my own. At the moment, I'm not there. My mom will be coming with me when she has got the jab, the vaccine, COVID vaccination. I wonder what do I need to fulfill, what criteria in order to get a social worker?
So you think you need, so I think first you need to think what kind of support do you need to make your life kind of.
I mean, because I've been accused now of when I complained about the corridor not being clean, that the cleaner wanted to leave, that he had tears in his eyes, and I was beaten by bed bugs recently. I have cockroaches. The corridor has not been clean for many months. I got evidence, I took some photographs, I have got a witness to it, and everything turned against me. And it started with the ongoing noise that I could not sleep in the night. And I just can't. I've got so much evidence. I've been writing to them. I've got my case with the MP, and it's the nasty woman, she turned against me. And I remember once I ended up, because of the threat, the emergency, they took me when my mom was there. And it's something, lies are written that I was this and that because the TV was playing loud. But I need somebody to help me when I, with writing those letters, because sometimes I just feel like I cannot go on through this on my own anymore. It's just my brain is empty. I'm so, so stressed. And at the moment, I'm with my mom because of what's happened. We are stuck, obviously, because of the COVID. I've got the case with the solicitor now. One solicitor completely, he took the case, but he did nothing. So I went to the law center in Waterloo. So she's writing now letters, but I have to, when I have the hearing, I have to speak for myself because they don't give you anybody. And I'm so fed up. If you go to the Facebook Clarion Housing, about people, tenants, what they have to say about them. It's the worst agency in the whole country. They are very, very bad.
Yeah, I've heard tales about awful things about Clarion. I can totally sympathize with you. I think the thing about social workers, so because your situation sounds more like you just need to be rehoused. I think and social services sometimes can actually help with that.
But can I just say something? Why should I, I put quite a lot of money into this flat. My flat is nice. My mom, she put the flooring. She did it. She wouldn't, it was like about 10 years ago now. Why? I mean, when I moved in, there was a family with 3 children living above me. I didn't have an issue. I didn't have a problem. Only when this woman moved in and she had, her first child, she's not looking, she has got a social worker. She's not looking after the children properly. And they are like playing, they're having a playground on my head. And how am I, even if I moved, how do I know what neighbors I will have? Because obviously in the council housing, mostly, there are people as they are, but not everybody is like, the council housing.
I wonder, I don't know, Charlotte, what is it? It sounds like, basically, I think it sounds like you need someone to kind of really look at your situation and see where the best way to go is. So maybe because I think social worker could so you can what I could tell you from based on like what I said is you can call local authorities, so Merton or whatever local authority you live in, and tell them about your needs. But you can maybe say, because support for social care has to be connected with your impairment. It can't be just any kind of thing. So you could,
I mean, I have anxiety and other physical issues as well.
So and then potentially they could help you, but I'm not. I think someone needs to kind of listen to what you say in the greater detail and see whether realistically you will get anything from social services, because I think social services might not necessarily help to deal they don't help to deal with neighbors.
Maybe I can give you
or with
Clarion, on the whole with Clarion, because you're right.
Jolanta,
they don't help you. They
maybe I can give you a call and we can speak about it in a bit more detail and see how we can help you.
Okay, that's fine. Sorry, but just one more question about the social services in Merton. So what cell directly I would have to contact? Social services in Merton.
So Charlotte, maybe if you, Jolanta, if you have a conversation, because I'm sure Merton still will know much better. If you want a care assessment, you have to, they usually put like on their website, they put a number that you usually you call first and they take your information and then they come and assess you.
We can help you with that. We can help you with that, Jolanta.
Thank you, Chantal.
I'll give you a call and we can speak about it in a bit more detail.
Okay, done. Thank you.
Okay, great. So I don't know if there are any other questions. Just, I suppose maybe those who were interested already read what's written in here, but it's just some tips to say, making sure that, you know, everything is in writing, get copies of your document, ask explanations, flag up issues early on, it's basically the care and support guidance is available online, and it's not written in a legal language. It's actually quite, well, relatively easy to understand. So if there are problems, I'd kind of suggest just read it and find, or obviously you're lucky because you have Merton Sill, and Merton Sill has service that supports people with CARE Act kind of advocacy. So ask for advice. And just very quickly to say that most decisions around social care could be challenged legally, and they could be challenged to the ombudsman. So put a complaint in, and then see what your options are if you're really stuck. So yeah, that's it. I put a link here. We have a website where we have a lot of information about disabled people's rights in different kind of areas of law, and including social care. So it has also like different templates of letters and complaints that you could use to try and move things forward. So that's it from me. I don't know if there are any other questions.
Thank you.
Comments.
How often can you ask for an assessment?
There isn't there isn't anything to say that you can ask only like once a year or twice a year or whatever.